You can start.
Oh, okay. Hello. Hi, everyone. I don't know if it's morning, afternoon, or evening at your end. It's nice to be here. It's nice to connect with Autism Connect. It's a pleasure. My name is Salome from Dilla. I'm from Nigeria. Yes, I'm a special needs therapist and consultant. I'm also the founder of Haiti Educational Consult, a breakout of Haiti special educational needs services. Yes, and I would like to share just a little about regression in autism and why it occurs. Yeah, because I've had experiences and I had to do a little research and found out why some of my clients had to reasons why the regression was kind of paramount. So I felt there's a need for other people out there because I knew there's a lot of frustration by other people, parents, caregivers, special therapists out there. So that's why. So just a little welcome. Yes. By understanding regression in autism, yes, it is vital for early identification, fitted support, and optimizing developmental outcomes. Also, recognizing patterns allows for early interventions, personalized services, and family support. That is one reason why I'm bringing this up. Studying regression informs research and clinical practices, also enhancing intervention for individuals with autism. So we embracing a comprehensive understanding of autism is key to promoting positive outcomes and supporting individuals with autism spectrum disorder effectively. Yeah. So now, when we say regression, we all know that regression means like declining. Yes, a way of declining or coming down or something. I'm just looking for that very easy word. But what is regression in the context of autism? Regression refers to the loss of previously acquired skills or developmental milestones in children with autism spectrum disorder. Yes, few years ago, I worked with a child and I still work with that child, but it has been quite frustrating because most times after reaching a particular milestone, the child regresses. And most times it's usually during the holiday. And it became quite frustrating for the therapist because I wondered why such things happened. In fact, at a point, I started blaming the parents. Yes, the parents have their own blame, but there should be a reason for all of that. Don't you think so? So I decided to do a little research and I got to understand that there's a thing called regression in the context of autism. It refers to the loss of previously acquired skill. So it could be language, it could be social skills, it could be motor skills, even behavioral. So it's just the loss of that skill that the child has acquired, and sometimes it's not. The child also doesn't find it. The child also doesn't find it nice because mainly if it's from the educational settings, yeah, I would try to explain that as time goes on. So regression, it refers to the loss of previously acquired skill or developmental milestones in children with autism spectrum disorder. So we have types of regression. Yeah, I know a lot of us will be like, why types of regression? But yes, we have types of regression. types of regression in autism are we have the language regression, social regression, motor regression, behavioral, cognitive, and the likes of it. But I'll just explain three. Yes, I'll explain just three. So let's go to, because those are the most common regressions that most of these children with autism spectrum disorder face. Yes, we have language regression. A child may lose language skills that they previously acquired. So if the child says like 10 to 15 words at the age of 2, because they have been diagnosed with autism, regression might make them lose such words and maybe just have 2 with the mama and the baba, that's all, or nana, or that's it. So it can involve a decline in vocabulary. That's if the child has a very, very large vocabulary bank, it could be a decline in that aspect. It could also be speech clarity. It could also be sentence structure. That if the child is able to at least give a good sentence structure before regression, once regression occurs, there is no more, the child won't be able to give a well-structured sentence. So if I have a pencil with me and then normally the child will say, this is the pencil, it might just be, the child might just say pencil without stating, without giving out a structured sentence. And sometimes it also covers the overall communication abilities. That's what language regression covers. Then we also have social regression. It involves a decline in social skills and interaction. We all know that most children with ASD lack social skills. Then having a regression in social skills and interaction, that is like a very, very huge gap. Children may exhibit reduced eye contact, diminished interest in peers, decreased responsiveness to social cues, always by themselves, even if you have, they might have developed that social skills right from time while therapy is going on or while educational intervention is going on. But with time, because of social regression, they have diminished interest in peers, they have decreased responsiveness to social cues, or withdraw from social situations. So I used to have a child that she suffered from social regression because anytime there's anything socially going on, she was always eager to participate, but all of a sudden she stopped. She could just go sit in her class and never want to participate. She prefers to be on her own. So I realized that was a social regression and we had to do something about it immediately. Yeah, then we also have motor skills regression. One who experiences motor skills regression most times demonstrates a decline in motor skills or gross motor skills, like either fine motor skills or gross motor skills. It can impact their abilities to perform daily tasks requiring physical abilities. So if the child is finding it difficult to, maybe the child might have been able to have a good pencil grasp, yeah, at least, and then regression occurs, then the child isn't able to have a fine motor skill grasp. So entirely regression has come in place and the child has lost the ability or the ability has declined. Yeah. So I'd like to share a few on behavioral because I know that most of us still wonder if regression occurs with behavior and cognitive. Yes, it does. Behavioral regression are changes in behavior that were previously more stable. So if you had taught a child a particular behavior, and the child has been stable on that behavior, the loss of that behavior for a certain period of time might be as a result of behavioral regression. It could include an increase in repetitive behavior, difficulty in transition, and sometimes heightened sensory sensitivities or challenges in emotional regulation. Yeah, then cognitive regression, it involves a decline in cognitive abilities such as problem solving and attention, or sometimes executive functioning skills. Children who suffer this may struggle with tasks they previously managed or show signs of doing well with. So they might suffer a decline in it. So I always get this question anytime I talk about regression in autism. And I also asked myself this question before I did a little research, and I found out that yes, regression occurs most times. So I got this question a lot. Can a child with autism have all types of regression in autism? Yes, they can. And even though there are causes which I would share, that is why the topic for this live session is regression in autism and why it occurs. Yes, they suffer regression, like all types, all forms of regression, and they have reasons for that, or there are reasons why they occur. So we have frequencies of frequency and timing of regression. I know that most people keep wondering if regression happens every time, or it just happens once in a while, or how many of these children, because there are a lot of people out there might think, okay, all children with autism spectrum disorder have experienced regression or will experience regression, but no, not at all. Not all children with autism experience regression. Regression can occur at different ages, but often happens during early childhood. So I'll share the frequency, because not all children with autism experience regression, but about 20 to 30%, according to research, of individuals on the spectrum do suffer from regression. Yes, they experience regression. It varies, even though it varies according to different degrees of impact on developmental progress. Yes, and timing, when it comes to timing, regression can happen around the ages of 1 to 2 years. Some children show signs of regression in the first few years of life, often around 18 months to 24 months. And this early regression can involve the loss of language and social skills, and even sometimes play abilities, because, at the age of 1 and 2, that is where the children develop lots of play activities, and then once regression sets in, play activities or abilities declines, they lose interest or they don't participate in play and the likes of it. And later regression, we have from the ages of 3 to 4 years. It occurs between the ages of 3 to 4 years, affecting language, motor skills, self-help abilities, because at that age, these children are supposed to learn how to, at least because they get to develop motor skills. Most of them begin to learn how to grab and the likes of it. So they decline in social interaction, language skills, motor skills, and self-help skills. And also regression happens in adolescence, that is during the period of puberty. Yes, and it occurs during that period. This period of regression may involve changes in behavior because even with the neurotypical children, once puberty sets in, we all know that there's a little bit of changes in behavior. Then imagine when a child whose brain is wired differently has all of those things in place. So there's definitely a change in behavior, in social skills, in communication, and adaptive functioning. Yes, and sometimes the timing triggers can also cause it. Yes, triggers can also cause um, regression in autism. So such triggers are sensory overload and sometimes environmental factors. And stress is one major reason, as I said, and major life transitions sometimes can be a factor. Yes, can be and cause regression. Yeah, and cause how frequent regression occurs. Factors contributing to regression. But before we delve into that, I know that maybe because of this, a lot of people might have, or you and I who are on this live might also be asking, does regression in autism occur more than once in a child with autism? Yes, it does. Regression occurs more than once, and that is because of the timing, like I stated, and also that is because of other environmental factors, triggers, and sometimes education. Yes, the therapy standard of the education, it might not just fit the child, it might not just fit, it might not be suitable for the child's needs, but we as a therapist or as a parent, we feel that the child needs it, so it might cause the child to regress. Let me share a story. The reason why I embarked on this journey of research for regression is because I have this 7-year-old boy, as at then 2 years ago. Yeah, he was 7, and his frequency in regression was something else. You know, the school term here in Nigeria is usually 3 months, and then we go on a break another 2-3 weeks, depending on how the calendar works. And by the time we go for breaks, by the time we're back, I notice a lot of regression, and we have to start afresh. And because I work in a school setting, it's more like his individual educational plan and IDP isn't changing at all. Because what we worked with last time is the same thing we have to work on this time. So there is no, even though we do an IEP review, it's either we add to the IEP or nothing changes at all. So it became alarming to me because I wondered why this boy wasn't progressing. Instead, I could notice a lot of regress. So I decided to just observe, and then it got to I got to understand that okay, yes, there's regress, but there should be a cost for this regress. I had to ask his parents. I called in the mom, and the mom said she doesn't notice anything. I said, well, that's just because you don't really work with the child. Yes, sometimes we have parents who can be that careless. Yes, I'm sorry to use that word. Yes, they might be too busy, but at the same time, here in Nigeria, it's something else. And then I called in the dad, and the dad opened up. He told me the boy's growth milestone, like how well the boy did. He grew while he was 3. He became mute. So before he got to 3, he had he had like a bank of vocabulary. But at the age of 3, he lost it. He could only call his dad's name, like his dad's real name, and no other person in the house. So if imagine the child had like 50 words in his vocabulary bank and then lost everything, which we don't know the reason why. And then now it's happening again. But then they didn't do anything about it. They traveled out of the country, and I think that was when the child got diagnosed with autism, and then he was placed on intervention. And I don't know how it went though, but it was more like, okay, and there's hope. Something is going to happen definitely. But even though they had started therapy, he declined again, and he came back to Nigeria. This was the story that dad told me, and then I got to realize that this boy was suffering from regression, but I didn't know the cause. And because during the holidays, there was nobody to continue with his therapy sessions because the parents are not paying for like holiday sessions, just the school term sessions because it's an inclusive school. It became a thing of worry. So I called in the mom again because the dad had shared his own story with me, and then I called in the mom and I advised that he's being placed on home therapy sessions. And she agreed, but they had a discussion with the dad and they never agreed. So as I took my time to research, I found out that this child typically suffers from all forms of all types of regression. I might not be right, yeah, but I could see in behavior there was a regress. This boy could express his emotions. He could tell when he's angry, when he's sad, and the likes of it. And then all of a sudden, the regress made him to start screaming when he's frustrated, screaming when he's sad, screaming when he's angry, screaming when he's even happy. And I got bothered a little, and I asked myself, why is this so? But then I had to find out that, okay, because there is no follow-up at home, it might be as a result of the lack of follow-up. That is why there is regression. That is why I said educational factors also can contribute to regression in autism, even though I have not gone deep into that. I just shared it earlier. Yes. So I found out that this child, the therapeutic approaches we use doesn't sit well with him because there is no follow-up at home. Now, because I have found that out, I had to call both parents, and then they came in and then we had a meeting with them. Now they had to go start looking for diet plans and the likes of it because we found out that he had I think he had immune system dysregulation. We just had to just tell them to go in for medical checkups so that things can get well, things can be better. So one contributing factor to regression in autism and why it occurs is because of genetic factors. Yes, most children, I don't know, sometimes research says it's not inherited, but recently we've been hearing stories of people or children who inherited autism spectrum disorder from their parents who didn't even know that they had autism. Yeah. So genetic predisposition and mutation can play a huge role in regression in autism. Also, variations in genes related to development and connectivity may also contribute to developmental regression in some individuals with autism. Then, neurobiological factors. These are changes in development and connectivity. It may impact in various skills and behaviors. We also have environmental stressors such as exposure to toxins, infections during pregnancy, or early childhood stress can cause potential triggers, which I have stated earlier, that triggers can also be one reason for the frequency of regression, because I've said that regression can happen not just once, it occurs like depending on which stage the child is. The child might experience it early stage, later stage, adolescent stage, or triggers can also push for regression. Then we also have, like I stated, therapeutic and educational approaches. In some cases, the intensity or type of therapy or educational setting or intervention used mainly, I'm sorry to say, like applied behavior analysis, because I know most parents now, they bounce the idea of applied behavior analysis. They don't just like the idea. They feel it does not sit well. It is more like a robotic way of training a child. Yeah. It may not be suitable for that child, and it might be leading to stress and anxiety and potential regression. So, like for the child I had told you about that I work with, I feel it's because of the educational approach, which the parents can also not meet up from the home front. That is why he always experiences regression. Yeah, sensory overload, immune system dysregulation of immune system and inflammatory process in the brain can also cause regression. Yeah, gastrointestinal issues can also be another factor contributing to regression. So the impact on families. I know I had stated earlier while I was sharing the story of that child I work with. The family, the boy's regression has really had a very, very not positive impact on the family, because the mom is frustrated. She has lost it completely, because she feels she's failing, but no, she's not. It's because she's just not meeting up with the educational setting. Even though I know that there are times we've called her in to get her training, but sometimes we all have this fear and anxiety. What if we're not able to meet up even though we're being trained and the likes of it? So sometimes regression in children with autism can cause the family a lot of stress and anxiety. It can cause them changes in their daily routine, because they would want to see that they meet up, which, like I said, not every family would want to change their routine, and then at the same time it's affecting the child who is regressing now. Their financial challenges related to therapy and support services. Because this child that I work with is experiencing a lot of regression most of the time, like almost every 3 months. I had recommended they go for medical checkup and the likes of it. So you see, it might not be part of their budget, it might not be part of their yearly budget, but they just have to just keep going to the hospital so that they get everything right, so that they know if there's a problem. It might just be that this child has an immune system dysfunction or something. I am seeing it from the educational aspect that it might not sit well with the child because of the educational approach. That is why regression is occurring. But by the time they go out there for medical checkups and visit specialists and all, they might be able to find a solution, or might be able to know the cause of his regression, why it occurs, the reason why the regression occurs. It might be, like I stated, the factors contributing to regression. It might be genetic, it might be neurobiological factors, it might be immune factors, immune system dysregulation, it might be sensory overload or processing difficulties, it might be gastrointestinal issues, and the likes of it. So it has affected this family financially. They might not state it, but I know, because it's huge money to go to the hospital here in Nigeria for such things. So I'm very sure out there, wherever we all are, I'm very sure it's the same thing, going for medical checkups, either part of the insurance or the whatever that takes care of our medical bills. It might be huge, a huge challenge. And also related to therapy, you might want to do behavioral therapy differently, you might want to do speech therapy differently, you might want to just do ABA differently, and other educational support. I know, like here in Nigeria, because the parents don't feel, there's a child that I met the mom, she doesn't feel like an inclusive school is what the child needs. She takes the child to a regular school, and then after school she takes the child to a support service session where she feels he can get what he wants. So that is extra pay. Imagine paying a huge amount of money for school fees and then going to pay for extra support services and the likes of it. So it impacts on this family either positively or negatively. But most times it's usually negatively, because it's usually in a negative way because of the whole stress, the whole challenges in finance and all. So before I conclude, I would just like to share the importance of early identification and impact. Importance of early identification and intervention. When regression is noticed, or you notice that your child is either pulling away from social interaction or begins to lose words or the likes of it, please, I would advise that we seek timely support, because it is key. It allows for prompt interventions and support to address emerging challenges. And also, like for this child that I work with, because of, I feel also because of lack of family engagement, like I said, because the parents cannot meet up with the educational approaches from the school. That is why he is regressing. So if the family can get themselves engaged or equipped with the knowledge and resources needed, it will do well for intervention purpose. Yeah, and then for developmental purpose and progress, and the well-being of the child, it is good to implement fitted strategies, like when early intervention, when early identification is done, it promotes progress and well-being of the child, which enables the fitted strategies that supports developmental progress and also enhances the child's well-being. And all of us are going to be happy because we all love to see progress, yeah. And I think because of that, it might not occur as frequent as I see it, or as we all see it out there. It might not occur as frequent as we all see it. Because by the time you realize that, oh yeah, this child suffers from regression most of the time, he usually has a decline, what you do is you're always on your toe. You always want to put in effort so that you see that that child doesn't regress as bad as you feel he will or he has. Because in cases of sensory overload, sometimes they are all over the place. They would want to steam, they would just want to do something so that at least they get to regulate their systems and all. So that period while they're supposed to be doing something for themselves, imagine they're in a therapy session of 1 hour and then they begin to steam. Yes, it's allowed and all, but if it's regular, that's to say the child's not learning anything and it's not suitable at all. So by the time we have an early identification, it's going to help the child meet his milestones, yes, and also help the child's well-being. So for early intervention, I would love to say that it's good for us to seek local support because most times we don't like to voice out, either as educators, either as therapists, either as parents or caregivers. I don't know why. I don't know if it's a thing of pride, but it's good you join local support groups where you can ask questions. Yes, it's a good part of the job is you have to be confidential, but you can share that you have a problem without calling the child's name. You can share that you have you can share that you have a problem without calling the child's name, or you have an issue without calling the child's name. And also, when you join local support groups, you can also seek for education and therapeutic approaches or services that suit the child, because sometimes there's a need for you to change. And also online resources and helpline. Because for me, I just had to go online and do research before I was able to get hold of what was wrong or what was bugging me concerning this child. And also training and workshops, something like this, live webinars and the likes of it. Yeah. So in conclusion, let us all emphasize on the importance of early identification and intervention in addressing regression and supporting children with autism. So, like I said, coping skills for these children, you have to sometimes establish consistent routines because sometimes it might be as a result of not having a consistent routine, seeking professional support and guidance, and self-care for caregivers. Sometimes it might be as a result of sensory overload or too much of stress for the parents or caregivers. That is why the children are noticing, and then it might also cause regression. Yeah, thank you very much. I don't know, do you have any questions that you feel I need to answer?